My name is Rick Galli, and I'm Director of Testing and Clinical Trials Implementation at NEXUS, located at St. Michael's Hospital in Toronto. And today I'm giving this e-poster presentation of our work entitled I'm Ready, Implementing a National HIV Self-Testing Research Program in Canada to reach the undiagnosed and connect them to care. And shown here are our community partner organizations and our funders. To reach an estimated over 8,000 individuals living with HIV in Canada who remain undiagnosed, NEXUS implemented the I'm Ready research program in June of this year, just 7 months after the first HIV self-test, which is fingerstick blood-based, was licensed in Canada. I'm Ready is an integrated program utilizing technology systems that include a mobile app to access free HIV self-tests, a comprehensive website with details on resources, information, and care pathways, and a virtual telehealth platform staffed by trained peer navigators for support. And all Canadians 18 years of age and older are eligible for enrollment. Through the I'm Ready Test mobile app, participants create an anonymous profile, answer surveys, order up to 3 free HIV self-tests for delivery or pickup at community sites, take the test, and provide results. Participants have opportunities to connect directly to peer navigator support before, during, or after taking the test through the integrated I'm Ready Talk telehealth platform. And participants can use the self-test kits to test themselves, or they can provide test kits to others within their social network and encourage them to join the I'm Ready project. So who have we reached in the first 3 months of the program? A total of 1,311 people consented and participated in the pre-test survey through the I'm Ready Test app. The mean age was 33 years old, with 46% of participants under 30 years of age. Participants from key populations included 630 gay or bisexual men having sex with men, 136 individuals from African, Caribbean, and Black communities, 61 Indigenous or First Nations and Métis peoples, and 38 people who inject drugs. Regarding sexual identity, 38% identified as gay, 28% straight, 13% bisexual, 5% queer, and 16% as either heteroflexible, pansexual, questioning, or preferred not to answer. 75% of participants are from large urban centers with populations greater than 100,000, 14% from medium-sized cities of between 30 and 100,000, and 11% came from small rural centers with populations less than 30,000. There was a total of 2,705 self-test kits distributed in every province and territory in Canada, which worked out to an average of about 2 tests per participant. 61% of these test kits were delivered by mail to a home address, and 39% were picked up at one of 80 community partner locations across the country. Of note, 25% of all participants were first-time HIV testers, including 33% of those less than 30 years of age. Access to peer navigators has been surprisingly low, with only 46 appointments scheduled in the first 3 months. 60% of all participants identified with at least one of the key populations, and as you can see from the graph here, nearly 50% are gay or bisexual men having sex with men, with smaller percentages from other key populations. And to date, 3 people have been reached who were undiagnosed with HIV, all of whom are from key populations, including one first-time tester. So in conclusion, for the I'm Ready portion of this presentation, these initial results are promising and show that use of technology such as a mobile app and virtual telehealth platform combined with low barrier access to HIV self-testing is effective for reaching the undiagnosed who are living with HIV, and also in encouraging first-time testers to access HIV self-testing. We're now taking steps to significantly scale up the I'm Ready program with the goal of ensuring health equity in access to testing and connections to care for all key populations in Canada. And I invite you to learn more at readytoknow.ca website. In these last couple of slides, I'm going to introduce you to some of the additional programs that NEXUS is leading that are about scaling up efforts in reaching the undiagnosed and linking them to care, and on bringing new tests into the Canadian market. Shown here is an exciting project involving the use of interactive dispensing systems that look very much like vending machines with a 4-foot iPhone fixed to the front. Recognizing that I'm Ready program may not be able to reach all populations in Canada, particularly those who do not have access to a smartphone, NEXUS is working in partnership with community agencies across Canada, along with government agencies and Smart One Health Solutions in British Columbia, with funding from CIHR and CanFAR to establish a network of interactive dispensing systems that will provide low-barrier access to harm reduction materials and HIV self-tests. This is very much a work in progress, and some highlights are shown here. We hope to have up to 100 of these IDS units across Canada over the next 3 years. The first sites are in New Brunswick in partnership with the Ensemble Community Health Centre in Moncton, where they are already dispensing harm reduction materials with one of these units, and we hope to be adding HIV self-test kits by December of this year. Each of these IDS units will provide easy 24/7 user access through coded identifiers unique to each user, such as a color plus avatar, plus a unique ID number. So an example would be a purple unicorn 24689. Anonymized interaction data collected, or data collection gathered directly at each unit using the touchscreen display through a short, simple survey, automated test and material dispensing and tracking for inventory control. And data flow architecture is still being mapped out, but it will involve a centralized IDS portal that can be accessed by NEXUS, with each agency also having access to their specific IDS unit data. And finally, this last slide shows some of the active projects that are focused on bringing new tests to market in Canada. REACH is conducting sequential multi-site clinical trials of 2 HIV testing products from US-based OraSure Technologies Incorporated. The first study is underway and is a healthcare provider study designed to assess the performance of the OraQuick Advanced Rapid HIV Test in point-of-care settings performed by untrained healthcare workers in both oral fluid and fingerstick blood. It's listed on the clinicaltrial.gov website shown here and is underway at 2 of the 4 sites, including Women's Health and Women's Hand in Toronto and Clinique L'Actuelle in Montreal, with the other 2 sites starting shortly. This study is a precursor to the next study shown here, which is the OraQuick HIV self-test study on oral fluid samples that are collected, tested, and interpreted by intended users. Data from both of these studies will be submitted by the manufacturer to support license applications for both the point-of-care test and the self-test, hopefully leading to there being a second licensed HIV point-of-care test and, importantly, a second HIV test that will offer a choice to users before the end of 2022. Next up is the POSH study, which stands for Point of Care Testing for Syphilis and HIV, led by Dr. Amita Singh at the University of Alberta with support from REACH. It is now past the midway point of enrollment with over 800 subjects from Northern Alberta now enrolled. The study is looking at the performance of 2 investigational rapid test devices that test for HIV and syphilis simultaneously, allowing for immediate treatment intervention for syphilis and on-the-spot linkage pathways for HIV positives. To date, they've identified 8 individuals who are living with HIV but have been undiagnosed, and upwards of 150 cases of active syphilis, including some in pregnant women, which are pretty staggering numbers and point to the urgent need to have these types of multiplex point-of-care devices approved in Canada for clinical application as soon as possible. The study hopes to wrap up by the end of this year and will work on providing the data to the manufacturers to support license applications shortly thereafter so that we can see these tests approved for use sometime in 2022. And lastly, Stuart Skinner and his team from Saskatchewan, with support from REACH, are following the lead set by Ami Singh with their own study designed to reach the undiagnosed living with HIV or syphilis. The difference here is that they will be conducting the licensed INSTI HIV point-of-care test as well as the investigational REVEAL rapid TP test for syphilis antibodies from MedMira with no multiplex testing. Saskatchewan is currently in the midst of an outbreak of infectious syphilis. Preliminary data from Saskatchewan's Ministry of Health indicates there were 902 cases of infectious syphilis in 2022, which is a nearly 10-fold increase from 2018. Of those 902 confirmed cases, 242 cases of infectious syphilis have occurred in people living in First Nations communities, and an estimated 527 cases have been detected so far this year, with more to be added as investigations are completed. The province has also reported 10 confirmed cases of babies acquiring syphilis in the womb, and 2 babies were stillborn as a result. So needless to say, the availability of licensed point-of-care testing devices will help to reach these populations that have been difficult to reach through the other intervention pathways. So data from this study will also be provided to Health Canada for subsequent license of the rapid syphilis test, hopefully by late 2022 or early 2023.